Rebecca Powers with Sterling-Lancaster Community Television. We're here at Animal Shelter Inc. in Sterling with Melissa Snitzer, the shelter manager. Today we're going to talk about some preparations you can make in the event of a family loss. This is Chelsea. She's a female 7.5-year-old hound mix. She's very friendly, loves to go for walks. Chelsea's one stipulation is she cannot go to a home with cats. Chelsea has a story where she's actually been returned to the shelter a few times for reasons that do not have anything to do with her. It was just her family's situations. So we're really looking for a good permanent home for her where she can spend the rest of her days. This is Canito. He is an 8-month-old male Staffordshire Terrier mix. He loves to go for walks, and he seems to be a fairly mellow puppy. Because he is a little bit older, he's almost full grown. This is Darcy. She's a female 3.5-month-old Chihuahua mix. She will stay fairly small, probably no larger than 20 to 25 pounds. She's very friendly, loves attention, and is very gentle. This is Wilson. He's a male 6-month-old Corgi mix. He's very energetic. He's a very friendly dog, and he is a dog that will need lots of exercise, so either a fenced yard or someone who can take him for lots of walks. This is Leonardo. He's a male 6-month-old Terrier Spaniel mix. He's very playful, friendly, likes other dogs, sort of your typical happy puppy.
So, Melissa, what can people do to plan ahead for their pets?
So something that people may not think about, but that is a good thing to think about, is what to do for their pets in preparation for the fact that a family member may pass away, or someone very close to the family may pass away, and they may have certain wishes for their surviving pet. So one of the things that you can do is you can actually write your pet into your will, if that is something that you feel is necessary. A good idea also is to talk to all of your closest family members and make sure that they know your wishes for your surviving pet. If your pet is older and is maybe on some medications or has special considerations, make sure that wherever your pet is going to go, say a close family member decides they would care for your pet, make sure that they know all of the details about what medications the pet needs and where the pet's been going to the vet, so that they will have access to records and be able to take the best care of your surviving pet as possible. So if you're in a situation where you don't have a close family member or friend that is able to take your pet if you pass, there are a couple of other options for you. One of the options is to contact a sanctuary, and these are things that you want to do well ahead of time. Trying to get an animal into a sanctuary at the last minute can be difficult. So try to think ahead and plan for this. Contact some places and see what their requirements are and whether there is a fee and things like that, so that you can also have some peace of mind knowing that if anything should happen, your pet will be well cared for. Another thing to think about would be the possibility of, if a family member or close friend will care for your pet, to leave them a little bit of money to help do that, especially if the animal is on special medications or things like that, just to help ease the burden. So if at all possible, leaving some money with your pet is helpful to the people caring for the pet. If the other option would be to bring the animal to a shelter, you can make arrangements ahead of time with some shelters. They have programs so that you can prepare. Our shelter does have such a program, and it is on our website. There's more information on there if you'd like to check that out. But one thing to keep in mind is that if your pet is older, adjusting to the environment in a shelter can be very stressful to an older pet, especially if they've lived in a quieter home their whole lives. So your first option, if at all possible, would be to have a close family member or friend care for your pet if you should pass.